It's hard to imagine, but in Iredell County, more than 1 in 8 working-age adults does not have health insurance. But for nearly 2 decades now, our uninsured neighbors have still enjoyed high-quality medical care thanks to HealthReach Community Clinic.
We are a true community-based clinic that works really hard thanks to the generosity of volunteers predominantly and so many community partners to make sure that people who don't have health insurance and who have limited means can still access high-quality medical care.
Located in downtown Mooresville, HealthReach provides primary and mental health care, pharmacy, labs, specialty care referrals, and much more, all at no cost to patients. All of this is made possible by local churches, businesses, civic groups, healthcare organizations, and individuals right here in Mooresville who provide the volunteer and financial support necessary to keep this free clinic in operation. Their contributions improve patients' health, keep them out of the emergency department, and help keep healthcare costs down for everyone.
We exist and are able to function because of the generosity of so many people who volunteer their time, volunteer their expertise.
Beginning in March of 2020, HealthReach faced what was by far its greatest challenge to date. The sinister coronavirus led to the sudden loss of key volunteers, supply chain shortages, and cancellation of the clinic's annual fundraising event. Patients with symptoms began knocking on the clinic's door long before HealthReach was able to amass PPE or offer COVID testing, all while patients with diabetes, heart disease, emphysema, and other conditions continued to need care. Instead of lingering in the unknown, HealthReach team members faced it head-on, pivoting on a dime. They created a new curbside pharmacy service, offered telehealth as a supplement to in-office medical appointments, designed a fully outfitted sick room to safely treat COVID patients, and provided literally hundreds of supplies from thermometers and pulse oximeters to blood pressure cuffs and nebulizers to empower patients to monitor and manage their own health from the safety of their homes. HealthReach became one of the first clinics in the area to offer free COVID testing and COVID vaccines. Remarkably, most of the professionals providing these services did so as volunteers, including the entire team of HealthReach nurses. They risked their own health and safety and that of their families to ensure that our most vulnerable neighbors would have the medical care and medications they needed. In the midst of the pandemic, HealthReach provided nearly 4,200 medical appointments and dispensed 10,000 prescriptions to uninsured patients. In a time when health services were least accessible but most needed, this organization stood strong. But now, HealthReach desperately needs your help. HealthReach has experienced record growth in the number of new patients applying for healthcare, and patients' needs are dire. The average annual household income among patients is less than $16,000, and the demand for mental health services has exceeded all expectations. The number of consultations provided by the volunteer psychiatrists at HealthReach will quadruple by the end of 2021 compared to 2019. Donations of cash and supplies are needed now more than ever. Medical professionals are needed to see patients at HealthReach and in their own offices.
It's absolutely critical to help us keep our doors open. We can't do that. We can't continue providing the great care that we do without the generosity of our neighbors, of our local individuals who see that we do have a need and understand that they absolutely can play a part in helping us do this work.